Hello, my name is Mayra Martinez. I'm going to be speaking today on telehealth. So for today, Telehealth Unlocked, Practical Insights for Modern Medicine. A little bit about me. I have been working in rural health, pediatrics, and telehealth, primarily telehealth for the past few years. There's been a lot of changes, a lot of new things that have been coming up. And currently, at the time of this recording, we're seeing if there's going to be an expansion for telehealth flexibilities. All of these insights will be very, very helpful moving forward. So today we are going to be discussing about what telehealth is. So we will officially define it, what the benefits of telehealth are, some of the HIPAA compliant platforms, equipment that could be used for home, resources, limitations of telehealth, how to perform an exam, and then we'll go over a couple of case studies that can be applied in telehealth. So to start off, what is telehealth? So according to the American Telemedicine Association, telehealth is a means of delivering healthcare services through the use of telecommunication technologies. And so this is including, but not limited to, asynchronous and synchronous technology, a remote patient monitoring technology by a healthcare practitioner or to a patient or a practitioner at a different physical location than the actual health provider. Some of the important definitions to note when using telehealth and in the telehealth community is what is defined as a practitioner. So this will mean a licensed, registered, certified, authorized, or exempt individual with the authority to deliver health and or wellness services to consumers of the state. So this is going to be dependent also on the state that you are going to be doing telehealth in. So it is important to know what are the state regulations when you are doing telehealth. Asynchronous, that is an exchange of information regarding a patient that does not occur in real time. So this would include secure collection and transmission of a patient's medical information, clinical data, clinical images, laboratory results, or a self-reported medical history. So an example of asynchronous could be a visit that is done just regarding some exchanges, some information, almost as if you were emailing with the patient, getting information, doing a diagnosis through that means. While synchronous would be an exchange of information regarding the patient occurring in real time. So this would be live video, live talk, either whether through video or phone. Remote patient monitoring, so this would be the remote monitoring of a patient's vital signs, either maybe biometric data or other objective or subjective data by a device that would transmit data electronically to the healthcare practitioner. An example of this would be if you were monitoring some type of glucose readings, oxygen readings, or so forth, where a device would be monitoring those levels. So this would be what we consider remote patient monitoring. Okay, so something to note is, what is telehealth? What does it do for us? And in what way is it accessible? So it does create value for payers, consumers, and providers. It does help increase access to healthcare. It enhances the reach of healthcare services. It is also very cost effective. We are outside of the patient room, so that all that cost is going to be reduced. One of the other things of telehealth is you can have 24/7 coverage. Overall, there is higher customer satisfaction. Overall, reduced cost is also going to increase the customer satisfaction. So overall, telehealth, very beneficial, very few things that would not be beneficial to the patient. For example, it is time efficient. You don't have to have the patient waiting in the lobby for a couple of hours sometimes if you're running behind schedule. It allows access to rural areas. So there are some areas in which just to get to a clinic, it might be an hour drive. Maybe in this rural area, there is no ease of transportation. There may not be buses or not might be any kind of city transportation available. So this would allow access to those areas. It also allows for the expansion of specialty care. So in some rural areas or in some areas in general that they don't have access to for example, GI, pulmonology, or something like oncology, it allows access to this type of care. This also aids in reduced exposure to those that are immunocompromised. So in our babies, in our elderly, someone who is on medication that would result them to become immunocompromised, this would allow these patients to safely receive health care. This is also beneficial for patients with limited mobility or limited transportation. So, for example, if you have a patient who is wheelchair bound or bed bound, to be able to do a visit with them and having them come all the way to your clinic, definitely a barrier. So, telehealth allows for you to be able to do some monitoring through those means. There are many different type of HIPAA compliant platforms, and there are more that are popping up time and time and again. So these are just a few examples if you wanted to incorporate telehealth in your practice that you could use. A lot of these are going to have some kind of a free version available. If you wanted to have more added features, then of course at this point you would consider doing a paid version to have those features. Doxy.me, Doximity are the most common ones that you've seen used. And just remember that you do need to confirm that they are HIPAA compliant. Pre-COVID, some of the flexibilities did not exist. So, for example, you were not able to use certain platforms, they weren't HIPAA compliant. Then during the pandemic, some of these flexibilities were implemented. There were some waivers. There was even a time that you could do a visit through FaceTime, for example, or WhatsApp, or one of the other types of telecommunication like video chats or phone chats, in which it did not require it to be a HIPAA compliant platform. However, we do need to be cognizant that we are not going to be allowing platforms to be non-HIPAA compliant anymore with these flexibilities that have been changing and with the new flexibilities that might be changing as well. Some other things to consider would be equipment that would be helpful for a telehealth visit. And a lot of this equipment you can have available at home at your disposal. Some patients might have this already. They don't need to go out and purchase it. They may borrow a blood pressure machine from a family member. They might have access to something as simple as a ruler if you wanted to measure the size of a lesion to compare the area of erythema from the day before to today. A scale, just simply being able to have a pediatric patient get on a scale so you can confirm the weight of that patient so that you can do weight-based dosing. A thermometer, so we can confirm if there is a fever, a pulse oximeter. So there is a lot of equipment that you can use at home. I mean, even like a measuring tape. Some patients might even have all of this all at once. Some of them will even have like some of the ear ones, and we'll go into more of that in a little bit. So the digital technology, and I think a lot of patients have either come across some of these. The digital otoscope, I think, is the more common ones that some people might purchase, but the one thing that most will have is a smartphone or some kind of a device, like even an Apple Watch. So if they had access to a digital stethoscope, those are really great. They can upload or share what the findings are. You can listen to sounds. A digital otoscope, they can just put it in their ear, like if they were getting a temperature check, you could take a nice little picture and they can upload it or send it on a lot of these platforms. You would just request for them to share and it would be able to share that picture with you. And now with all these new smartphones and devices, there's so much data that can be shared as is. However, take it a little bit with a grain of salt because it's also going to be dependent on the user. So if possible, whenever you're using any kind of this technology, like even a blood pressure machine, I would see if you can have the patient do it in front of you so you can walk them through it so that they are using it correctly. So that way, if they're going to be doing, for example, a blood pressure reading, that they are using it in the correct way and that you are not prescribing medication or basing your diagnosis on a number that they're giving you that could be incorrect. You also have availability to at-home exams. So there are so many things now that patients can buy or purchase on their own. So for example, over the counter, they can get like the 2-in-1, the COVID and the flu test. And so within 15, 20 minutes, you have a reading of they're positive for flu, they're positive for COVID. They now have like the fecal coagulate home tests. There's even the H. pylori stool antigen home tests. There's the UTI test strips that you can buy, and I have a picture of it on here. Like these are available at Walgreens. There's pregnancy tests, and if they had a glucometer at home, they could do a glucose reading. So there's a lot of capabilities to be able to test a patient at home. So there are methods in which you could, prescribe. For example, you might be able to prescribe a whole COVID test. Some insurances may cover it, some may not. However, just be aware that you have many, many, many options if you are attempting to see a patient that may not physically be able to come to the office, but you want to practice medicine, evidence-based medicine to the best of your ability. So having these tests available would really help aid in that. So there are other resources at your disposal, laboratories, imaging centers, for example, the at-home exams that we talked about earlier. The best thing to do is be aware of what is around the area that you're practicing in. So if there's a laboratory that's local to the patient, you can have your office, or if you have a capability to do it like from your computer, a lot of these like Doximity, you can do faxes, and all of these platforms can give you the option of doing orders that way, or you can send them to the patient, have the patient take in an order. So if you wanted to do blood draws, you can have them go somewhere locally. So although the patient may not physically be within your area, you could order the test that you need and then follow up with them for the results. So it'd be very important to note of what laboratories, imaging centers, what requirements they would need for that. And again, with the at-home exams, things are changing constantly, and they're COVID exams or flu exams that you can order. Okay, so with everything, there are limitations, and especially in telehealth. So what are the limitations that we have? Breath sounds, right? So unless the patient had access to like that digital stethoscope, you may not be able to hear all the breath sounds. There are some breath sounds that you might be able to hear on telehealth, like if they're having an audible wheeze. Now, heart sounds, that would also be extremely difficult just with the digital stethoscope as is, and without one, it's going to be impossible. Pulses, and you can have a patient like check their own pulse and see if they could tell you what they're sounding like, what it sounds like, and hearing if it's like regular or irregular. However, unless they were to be, unless they had like an Apple Watch available where you can check for like a regular, irregular pulse, or unless the patient's like incapable of doing it, like this is going to be a huge limitation. Touch is another one. So we have to depend on the patient's touch, not on your own. So be able to tell if the rash is, rough, if it's scaly. And the other thing is smell. Something like, for example, a patient that would to be in front of you, if they were to have, if they smelled like alcohol, if you suspected that they may be abusing, that would be something that would be limited, right? So smell. So some of these things would be a limitation. However, there are tips and tricks that you can use to kind of get around it. And the most important part whenever you're practicing telehealth is to be very aware of your limitations. One of the most common things that we want to do is practice medicine just the way we would in person. So nothing should change other than the creativity in getting the information you need to make a medical decision. So for example, if you wanted to diagnose for strep, just because you're on telehealth, you still need to do something to have the evidence-based medicine to back you up, whether it be like the Centaur criteria or some other means, having them do a strep test at a lab. So either way, limitations are going to be that the patient's not physically there, but still we're going to practice medicine as closely as possible as we would to in clinic. Okay, so now let's talk about the actual telehealth visit. So now that we are ready to see our patient, what are the things that we need to be aware of? Okay, one thing is that when we're setting up for a telehealth visit, just make sure that you're in a place where you have good internet connections so that you can avoid any potential technical issues. Check the lighting. Are you going to be able to see the patient clearly? Is the patient able to see you? Whenever you're providing instruction, when you need to tell them to do a certain type of movement. How is the sound? If you don't have a really clear sound, like again, there are certain things that you're going to be trying to listen for. Or do you hear any audible type of wheezing? Are you seeing the patient in any type of distress? And if you don't have the proper lighting, you can't see them clearly, that's not going to be a good visit. Also, are they in a safe environment? A lot of the times you'll have patients that they're just driving to the store and they just want to connect for a telehealth visit, but that is not something that we want to do. We want to make sure that the patient is safe. They're not going to get into a motor vehicle accident while on the call with you. So definitely make sure that they're either safely at home or somewhere where they have your full attention, and you can do a proper visit during the time. So before you even start the visit, make sure all of that is set up. Other thing I want to note is make sure that you're in an area that you're not going to be interrupted, and that you can maintain patient confidentiality. So if you are, let's say, doing telehealth from one of the rooms in the clinic, if there's patients passing by the hallway that you don't have the door open, or that there's some kind of soundproofing so that not the entire world is listening in onto your visit. So be aware and be conscious of any possibilities where you may not be able to keep all of the information confidential. Okay, so now that we've taken care of everything, the setting, the sound, the lighting, now we are in the visit. What are the main things that we need to do? So the first thing we need to do is use our own senses. So what is it that you see? Are we able to see the patient's skin color? Are we able to see if they're in distress? Are we able to see how they are walking? What can you hear? Are you able to hear any type of wheezing? Are you able to see if they're like grunting, if they have any type of pain or discomfort? Sometimes if you're seeing a pediatric patient, they may not be able to tell you that they're in pain, but you may be able to physically see it. So these are the things that you would normally notice in clinic. However, the limitation is that you're behind a screen. So we have to make sure that we have the capability to be able to see that. The other thing is that during the visit, just make sure that you're engaging with the patient by nodding, responding in tiny little ways to make sure that you have that full engagement, either by, acknowledging what they said, repeating what they said. So if the patient says, I'm having difficulty with moving my arm, it's okay, I hear that you're having difficulty moving the arm. Which arm? So just confirm that you are listening, that you're hearing. And sometimes it's difficult because depending on how your display is set up, maybe the camera is right in front of you, for you to be able to see the patient, but then where you're seeing the patient's picture, maybe it's on another screen if you have multiple screens set up. So again, you just want to confirm that they're able to see you. So just because they're not seeing you this way, that you might be to the side, that you're engaging with them. Also, make sure that you're clearly explaining everything that you want them to do. And that could be very difficult because essentially the patient is performing a physical exam on themselves at times at your direction. So try to make things as clear as possible. Use simple verbiage. Basically, if you're going to tell them to extend the arm, you can try to show them, but you don't want to say things like, I want to see flexion. You might say like, hey, I want you to move your arm like up this way or down or left or right, rather than extend or flex. They may not quite understand that. So clearly explain it with as simply as you can, and document any observations that you see. So for example, if you saw that the patient flinched whenever they extended the arm, make sure you notate that. The patient grunted when they, palpated the stomach, or maybe they had someone else in the room that is helping them. If you had like a parent taking care of a child, or you had an elderly patient and their caregiver is the one that's helping with the physical exam. So document what you see. Something as simple as they're looking slightly more tired than usual. they're taking a little bit longer time to respond to your questions, okay? Also, you need to document what the patient did and how. So for example, if you're trying to say that the patient had difficulty moving their arm, we don't just want to say they had difficulty. Specify, what did they do? You know, they had difficulty whenever we asked the patient to extend the arm. You notice that one arm did not extend quite as the other, and it was with active range of motion. For example, it was an active instruction that you were giving them, or the caregiver helped them. You know, what was it? So you could say that the caregiver like passively extended the elbow or anything like that, or you had the patient, I don't know, do a squat. Like, what is it that they did, and document that clearly. So you don't want to say the patient had a blanchable rash. How did we get that information? The patient had shortness of breath. How? How did you see that they have shortness of breath? What did you do to get that information? It's going to be the most important thing when documenting for telehealth. Something else is not just what they can do, it's also what they cannot do. So patient was asked to stand and patient was unable to, or patient used 2 hands to assist in sitting up from the chair. You know, patient was asked to stick out their tongue and patient was unable to do so. Patient was asked to complete a sentence while walking, and they were unable to complete the sentence. They were only able to say, speak every other word, or they took a breath after every other word. So during the visit, you're going to be noticing all the tiny little things that you normally would either way. However, you got to document the instruction given, what they did, and what was the result of it. Okay, so now, the visit was done. You did everything that you needed to do. You got the information that you needed to get. What is next? The next thing to do is you want the patient to take all the important takeaways from the exam. You might ask them to write something down, or with some of the HIPAA compliant platforms that I mentioned earlier, you have the capability of sending them either messages, maybe you want to send them a link to a patient handout. If so, just confirm with them. For example, like on Doxy, if you're using Doxy and you send them like a patient handout, you send them the link, tell them, hi, can you really quickly check with me that you got the link? Can you go into the messages? Did you see it? Okay, I got it there. Or if you're using Doximity and you send them like a text message and, hey, did you receive the text message I sent with the patient information? Or if it's going to be a message that's going to be sent later, either through the Secure platform, or maybe it's on your on the EHR, just let them know this is how you're going to be receiving the information, or the aftercare instructions that we've discussed. Anything that you've done or that you're going to do, just make sure that you mention with them so that they get it. The difference between being in clinic is that you can hand them the handout, or you can give them whatever you like, and you know they walked away with it, and they may not read it, but you gave it to them. Here, if they don't know that they should be expecting a message, or they should check their email for some extra information, they might otherwise not know, especially some of our less tech savvy patients. So just make sure that they were able to get it. And then lastly, as a courteous moment, make sure that they disconnect first. That way, if they still had a last minute question, you don't accidentally hang up on them, and then otherwise you may not get that question answered, or some extra important information might be missed. So just wait a few seconds. They may not know how to disconnect. They might be just clicking randomly. If so, just take a few moments to just give them a second, or instruct them on what they need to do. Okay, so now I'm going to jump into, this is the important things that you need to know, but now we are on the actual exam. So let's talk a little bit more in detail as to what we can do when we have the examination. So it is a good way to start from top to bottom and keep that in mind, like the way you would in person. Okay, so for vitals, you would instruct the patient. This would be different from most places where you might walk into the room and vitals already on the patient's chart. Now, you have to kind of go through them step by step. You might be their only way, or their only source of getting vitals done. So, you know, after you've got all the other good stuff out of the way, you've confirmed patient's name and date of birth, you've given them their consent. Now that you're ready for the physical exam, let's talk about vitals and say, hey, what do you have at hand? Do you have a thermometer? What is the complaint? Is a thermometer necessary? Is the scale necessary? What are the things that the chief complaint is going to direct you to? Once you have an idea of what it is that you need, figure out what they have, get those vitals. And again, make sure that when you are documenting on the vitals, so patient self-checked temperature with a thermometer that was used under the left armpit. Temperature was 98.9 degrees Fahrenheit. Skin, if you're going to look at the color, capillary refill, we kind of instruct them on what to do for that. If there are any rashes. So overall, generalized skin. Now, when it comes to head, ears, eyes, nose, throat, what is it that you're seeing? There's a lot that you can document without having the patient do anything. And then, of course, have the patient do things. So are they having, equal facial movements, right? Are you seeing that one side is a little bit weaker than the other? Again, neck, is there anything abnormal? Is there any masses that you may see? Now for lungs, a little bit more tricky, like I said, unless you were to have like a digital stethoscope or something available, but there are things that you can see. Have the patient like open up the shirt. You can see how they're breathing. You can see if they're having any types of retractions. If you have a little baby, are they having abnormal breathing patterns? You can have the patient sit there and you can report the respiration rate with the heart. Again, you can have the patient do it themselves or the caregiver try to check a pulse, and you can count together, see if you can get a pulse that way. When it comes to the abdomen, same thing. For example, if you're trying to rule out an appendicitis, you can have the patient lay down. You can have the caregiver help do any kind of like exams on them. You can have them extend, like you can have them palpate, see if there's any tenderness, look at what the patient's doing. Neurological, same thing. You can have the caregiver themselves, see if they can feel any differences. If they have numbness or tingling on any side, if there's any weaknesses, you can have them move. And other things to note, are they having any difficulty with their speech? Whatever it is that you can see on the physical exam, just document. Okay, so on here I have a nice little chart, and it's just kind of a nice little, if you want to get it, like print it, this is a kind of nice reminder of what to do. So if you had the opportunity, you can go to vitals, so specifically for like weight, blood pressure, pulse, the oxygen, temperature. For the skin, if you see any like bruises, any rashes, any swelling, any there. For vision, you can have them see like, are you able to see me? Are you able to see anything? Can you hear me? There are some things that you may not be able to see, like sense of smell. How do you know they can smell something? But you can have them grab something and be like, do you smell that? Or the best we would do is like have a caregiver. If there's something like, hey, they're having issues, something that can smell or they can smell. So for lungs, have them hold their breath. You can observe if there's any like wheezing, any tachypnea. If you wanted to access the pulse, the data can be incorporated from the wearables, like I mentioned, with like an Apple Watch. Here it says like step 7, like the abdomen, is it firm? Is it tender? Do you see any distension? Extremities, you can have them check like their lower extremities for any edema. Neurological, check the speech, the gait, Romberg. Can you stand from a seated position? And the social detriments of health, you can see what's around them. And quite interesting with telehealth, that's probably the most insight you might have into what a patient is experiencing, living, what their life is like. They may come to your office visit in clinic and they're very well groomed, everything looks great. And then you have the actual office visit, and you might find out that they don't have electricity, they don't have running water, they may not have you might notice that all their windows are open because they don't have central air conditioner. They may not have any window unit. And if this is something that's going on, let's say in the middle of summer and you're in Texas and it is 110 degrees and you may otherwise not know. So one of the really neat things about telehealth is we've really had an insight to the way our patients live. You might notice that they all live in one bedroom. I had a patient once that I would have otherwise never known because mom never divulged, that you had like a family of 8 all living in one bedroom with one bathroom. And it was a rented room, and that was also their kitchen. Tiny little space for everyone. We would have never known. And this could be instrumental in diagnosing some of the things that we may not have understood properly. So it's really nice to have this insight. Okay, so now that we have all the information, let's try to do a couple of case studies on how we could apply these tips and tricks. Okay, so the first case study is we have a patient, an 18-month-old male that presented with a rash. They previously had a high fever that lasted 3 days, and then it resolved. After it resolved, then we started with the rash. So based on the history alone, we should start to get a feeling of what it could be. And our physical exam is just basically there to confirm what we think it could be. So now we have this little baby that has this rash everywhere. And so what could we do about it, right? We have the history. I mean, we did everything that we could. We got whatever vitals we were able to get, but we've got this rash. And now the most important part that I want to rule out is this rash blanchable? Is it not? So one tip that you could use is what we call the tumbler test or a glass test. So you can get the parent caregiver to grab a clear glass, press it either on the side or the bottom firmly against a rash. And you can see if the rash fades under the pressure. So then if it fades, it's blanching, it's less likely to be anything serious. But if it does not fade, it's not blanching, then this would require urgent evaluation. So although your history gave you all that information to tell you, I think I know what this is, still, how are you going to, on telehealth, justify that you told this parent it's nothing to worry about, it's going to go away on its own? What information do you have to support your diagnosis and your advice? Tumbler test, glass test, great way to use for multiple rashes just to see if it's blanchable or not. Okay, so it was roseola. The treatment would just be supportive care. And for example, this is a great patient handout, and I put the link here. You would just copy and paste it, give it to the parent after everything that you discussed, and you're good to go. Now, they may have more questions, or you may want to follow up in a couple of days. So maybe in person, you would feel more confident to not have them follow up because you saw what you needed to. And if you're still feeling on telehealth not quite confident, a close follow-up would be great. You could follow up in a couple of days, or if the rash were to get worse, have them follow up with you. And if so, then you can repeat the testing, you give them their ER precautions, but you might closely follow them a little bit more, being that it's telehealth and you may not feel as confident. So let's move on to the next case study. Okay, so patient number 2. Now we have a little 8-month-old that was presenting with cough, and the patient is febrile, and the patient is breathing weird, and that is all that you got. So again, we want to evaluate the patient. They might tell you that it's a fever. They may not have a thermometer. You're not going to just say it's not a fever because you can't prove it to me. But if they had it, it would be very helpful. And a lot of the times the thermometer is available somewhere, somehow in the house. But the breathing weird, like this is highly concerning. And I do want to highlight on this patient because there are going to be some things that should not be done in telehealth. A lot of parents, patients, caregivers may want to just do a quick telehealth because they want to avoid an urgent care visit, but they want to avoid an ER visit, but somewhere somehow that they know that they should go. And although telehealth, like I said, can have its limitations, one of the biggest benefits is that this patient that might not want to go waste their time at an emergency room, right? Because they might see it as that. It's like, I don't think it's anything. They might end up seeing you first through telehealth, and you can direct them more quickly to either having to call 911 or to the ER. So now that you have the patient, you want to quickly assess, is this something that would be something for 911? If you have a really great, for example, receptionist or someone that's handling your appointments, you might want to screen certain things or have them have maybe like a list or something and saying, hey, if they're telling you that there's issues breathing, like they need to call 911 or they need to go to the emergency room. However, even with all those protocols in place, like the number of times that they tell the receptionist that everything's okay, and then I get the visit and they tell me it's because he's not breathing well. So you still might get faced with these things as much as you like to screen them. But if you can at least have whoever's helping you make the appointments um, have something on the back of their mind where they need to be assessed more quickly or they need to be directed elsewhere to avoid that kind of stress and anxiety of the parent and as well as to delay care. So now we have our patient. All right, so now let's listen to this little beat. Okay, so we can see on this little baby, you can hear some of that breathing, you can hear some of those noises, and on top of that, you can see some of those retractions that are happening there. Um, just with a couple of seconds, you can tell that this baby is not at the baseline, and there's some things that you can note. So, with just a few seconds, you're able to get just a lot of information without a stethoscope. So in this case, it is very possible that this baby might have bronchiolitis. And for this patient, it would be advisable that the patient be seen in person. When you are having these types of breathing concerns with babies, especially, they can go south very quickly. And again, although it is extremely convenient to have a visit through telehealth, the most important part is going to be knowing your own limitations. So if you know that it's something that you may not be able to treat, that they can go south very quickly, that they are in danger of potentially having more significant complications. Absolutely, we are not going to try to be a hero and see if we can manage it at home and prescribe the medications just to see how they do. It's usually better to err on the side of make sure you get evaluated if possible as soon as possible. However, there are always going to be exceptions to what you're doing, but if you always keep that in mind that would I have done anything differently if I was in person, then absolutely go down that path. Make sure that whatever you do is going to be first do no harm. And although convenient, we are not going to be harming our patients just out of convenience. Okay, so let's try another study, case study number 3. Now we have a 20-year-old female, and she presented with some left ear pain. She notes she had been swimming lately. Again, something that just by the history alone, we can start to populate our differential diagnosis and ultimately have a whole entire plan. However, the other thing that we want to make sure that we do is we want to make sure that we use all the proper documentation and justify what we're doing and use evidence-based medicine just as we would in clinic. So we have this patient having that left ear pain. We're going to take a full history. Vitals might be difficult to take a temperature in that ear, but you can have them do maybe vitals in the other ear to see if there's any fever, if they had check temperature in the ear or check in under the arm if they have that available. Some other things that you could do is, are they having issues with hearing? You can have the caregiver have them themselves, like, hey, if you do, little snaps, does it sound different from one side than the other? So checking hearing that way would be something great. Again, we're focused on the ears. We are assuming it could be something like swimmer's ear, they've been swimming, but we don't want to just assume. We have to have our documentation to make sure that we support why we are leading down that path. Okay, so now we see this ear, and this ear looks like it's got some discharge. We see a little bit of swelling. We have a little bit of erythema, but again, we don't have access to look inside the ear if their tympanic membrane is intact. If it's not intact, we only can see this. Now, sometimes if the patient is moving a lot, like let's say you had a patient that has some type of disorder that they're just shaking quite a bit. You have a child that can't sit still and the parents trying to run around with them with the camera. A lot of these platforms also have an option of having a picture taken and they can upload it. So if you see that this is going to be really difficult, you can have them take a picture and then you can get that. And then also, a lot of these platforms allow you to get these pictures to be uploaded into your EHR. Again, to support your documentation and to justify what your diagnosis, treatment, and plan is. So this is a year that we have, and otitis externa. So remember, we don't know if that TM is intact or not. So it would be recommended that you were to use something with the assumption that you don't know, and use something that's non-ototoxic, right? So Ciprodex would be an option, or fluoxetine, using something to make sure that we are not going to harm the patient, because we can't confirm, we can't see that TM. And on here, I threw in another patient handout that you can share with them, and you can tell them like what it is that they need to do, what they need to avoid, to reiterate all the things that you told them. Again, patient handouts are going to be your friend, giving them as much information as possible, because otherwise you can't really hand them out. You might have difficulty confirming if they heard you, if they understood you, so you can give them something to go home with. At the end of your visit, you can always have them reiterate to you what it is that you saw. And again, because we are limited in some of the things that we can do, then we have the ability to closely follow up with them. Where otherwise, a patient with swimmer's ear may not come back to the office because they're doing better, right? They may not come and make the trip and spend an hour or whatever in the waiting room just to make sure that they're doing better. They're like, I feel fine, I don't need a follow-up. But one of the beauties of telehealth is that you can have a quick visit in 24, 48, 72 hours, check in. Are you doing better? Are you doing worse? Now, something else that I want to mention, because I just really wanted to note the picture, but there are things that you do on the physical exam and how you would do this, right? So one is you can have the patient, you can have them do it themselves. You can just tell them like, wiggle your ear, does that cause any pain? Wiggle the other ear, does it cause any pain? Press against, does that cause any pain? Press over here, does that cause any pain? If they have a caregiver or just themselves, it's like, is there any foul smell to the discharge? So there are things that you can add. And again, you're going to add it to your physical exam just the way you saw it and heard it. So if you saw that the patient wiggled and they said, ow, it hurt, or they grimaced, you'd say, upon manipulating the ear, the patient grimaced, or they said, ow, and documenting that, because that's how you let to your conclusion that there was pain. Where otherwise in clinic, you may not, you just may say like, there was pain with manipulation, but how did you come to that conclusion? On telehealth, documentation is going to be your friend. As much as you can, as much detail, essentially is what you want to do. Okay, so if you were to have an otoscope, that the digital ones that they have, those are fabulous, because they could just look inside, like take a quick picture, you'd be able to see the whole thing, you'd be able to tell. But again, the limitations are going to be based on what the patient has available for them. And that doesn't mean go tell your parents or your patients or the caregivers, go purchase a whole bunch of equipment you can have at home for in the future in case you need it. However, for certain patients, this might be a good investment for them. If you have a patient that is bedbound, if it's a patient that is unable to come due to transportation, or somebody that would require closer monitoring for, XYZ, this might be a good investment for them. And again, it's going to be more about like pros and cons. I mean, if it's something where they're going to be coming to your office for a blood pressure check, twice a day for 2 weeks, as opposed to purchasing that machine and they could do it at home and you can go over it and do the monitoring that way. Because we do have some patients that unfortunately don't have access to the machine, or their insurance doesn't cover it, so they will come. But if you had someone that's in a rural area having to drive 20 minutes or an hour round trip just for a blood pressure check may not be feasible. So for them, the cost that they would spend on gas or transportation or whatever that they needed to get there, it might be offset by having like that blood pressure machine at home. It's going to be on a case-to-case basis. So again, we don't want to pressure our patients to purchase equipment that they don't need, but these are some things that might be feasible for some. Okay, so I do have quite a bit of references on here. And I also want to note some other great resources for telehealth. If you did have any more questions, or if you did have more insight, there is quite a few areas out there. So for example, AmericanTelemed.org would be a great resource. They do have a lot of information. Telehealth.hhs.gov, they have a lot of information on telehealth as well. PAs in virtual medicine and telemedicine, PAVMT, also have a lot of information, and they even have CME opportunities. Sometimes they'll have web series, webinars, podcasts, and things related to telehealth. So if this was something where you're looking for more resources, that would be a great place to go as well. So again, my name is Myra. If you have any questions or if you had any other things where I can help you with, please feel free to reach out to me, and I'd be more than happy to help you on your telehealth journey. Have a good one. Bye.